Hi everyone, I'm David. Welcome to Asian Hospital and Healthcare Management. Here, we will discover the newest breakthroughs in hospital technologies, digital health, clinical excellence, and patient care innovation. Whether you're running a hospital, leading a care team, working with medical technology, or shaping healthcare strategy, you'll always find something that helps you stay ahead. Want more? Subscribe today at www.asianhm.com/subscribe and get the latest updates straight to you, anytime, anywhere.
Hello, I am Sarah, and today we're diving into the world of healthcare benchmarking. Julie Coope, RNJP, Associate Director and Global Health Lead at Berkeley Research Group, tells us how benchmarking helps measure provider performance and patient outcomes, and why it's key to driving continuous improvement. We'll explore the complexities of global benchmarking, unpack the challenges of inconsistent data, documentation gaps, coding issues, and fragmented clinical systems, and look at how these factors can distort comparative insights.
Hi everyone, it's great to be here. I'm Julie Coope, RNJP, Associate Director and Global Health Lead at Berkeley Research Group. Today we'll be looking at benchmarking in healthcare, why it matters, how it can be used to understand provider performance and patient outcomes, and how it drives continuous improvement. Benchmarking is needed to understand provider performance and patient outcomes, and this will explain how benchmarking can help drive continuous improvement. In doing so, we will address the complexities of global benchmarking and outline effective approaches and significant challenges. Today we will also address how inconsistencies in data access, documentation accuracy, coding fidelity, and fragmented clinical systems adversely impact comparative insights and the strategic decisions that are often made based on flawed data to improve patient care. From the moment a patient enters a facility to their eventual discharge and follow-up, every interaction, diagnostic test, and therapeutic intervention relies upon patient data. These interactions lead to even more data, and this expanding volume is just one of many real challenges for healthcare organizations in capturing, analyzing, and acting on that data. This challenge also provides hospitals and health systems with an unprecedented opportunity to help improve outcomes and experiences as well as organizational efficiencies, finances, and future planning. At the heart of harnessing data's true potential lies effective benchmarking, a critical tool for understanding performance, improving outcomes, and driving continuous organizational improvement. Benchmarking is the methodical process of measuring and comparing an organization's performance metrics against those of its peers, industry leaders, or established best practices. For healthcare providers, this requires expertise in interpreting their data so they can turn it into actionable insights that can help improve clinical effectiveness, patient outcomes, and operational efficiencies. With a shift towards more evidence-based practice and a focus on value-based care, the ability to accurately assess, interpret, and compare performance becomes increasingly important. The good and bad news for hospital leaders is that while some organizations have started to focus on this, most are just starting this journey. Benchmarking opportunities and challenges. A common misperception is that benchmarking provides rankings and a sense of who might be under or overperforming in certain areas. However, benchmarking's real value involves the insight it can bring to better understand why an organization is performing better or worse and using that information to better understand underlying causes. by systematically comparing key elements, ranging from clinical processes and patient outcomes to resource utilization and cost efficiencies, healthcare organizations can more accurately pinpoint areas of strength and critical opportunities for targeted improvement, and implement customized strategies designed to help improve the quality and efficiency of care delivered at their hospitals. When done correctly, this will create a continuous feedback loop, informed by reliable and accurate data. That is why we sometimes refer to data as the lifeblood of a hospital. However, this is easier said than done and requires skilled teams who understand the needs of an organization and how a hospital or health system compares with other organizations which have different criteria, incentives, regulations, and markets. What constitutes good or optimal performance can fluctuate, being quite subjective and having different meaning from one market, region, or country to another. For instance, a metric in a single-payer system might be unachievable or even irrelevant in a fragmented multiplayer model. Another real challenge is access to data. The proprietary nature of healthcare data, coupled with national and regional regulations governing data privacy and sharing, creates barriers to gaining a comprehensive comparative analysis. And even in instances where one can access the necessary data, inconsistencies in documentation and accuracy can compromise its practical utility. Additionally, the method of documenting patient information inevitably leads to discrepancies that skew comparative insights, rendering direct comparisons unreliable or misleading. Medical coding is the process of translating complex diagnoses, specific procedures, and a wide array of medical services into standardized alphanumeric codes. This represents a critical component of effective data aggregation and analysis. Inaccurate, incomplete, or inconsistent coding practices can lead to significant misrepresentation of patient conditions and treatment and compromise underlying benchmarking data, making it less reliable and misleading. Consider the implications of attempting to compare surgical outcomes across multiple hospitals when one institution consistently undercodes patient comorbidities, thereby falsely portraying its patient population as inherently healthier than it truly is. Such systematic discrepancies fundamentally undermine the validity and trustworthiness of any comparative analysis, leading to erroneous conclusions and potentially misdirected improvement efforts. Perhaps the most insidious and pervasive challenge arises from the fragmentation and silo effect typical of many healthcare organizations. Most healthcare providers have a patchwork of information technology systems that do not effectively communicate with one another. Electronic health records might exist in isolation from billing systems. Laboratory results could reside in a separate database from radiology images, and an entirely independent third-party vendor might manage crucial patient satisfaction surveys. This fragmentation makes it extraordinarily difficult to construct a truly holistic, unified, and comprehensive view of individual patient care pathways and overall organizational performance, requiring a change in mindset and culture. The challenges outlined above are far-reaching and inform strategic decisions for organizations. To effectively surmount these challenges, healthcare organizations need to proactively adopt a comprehensive and multifaceted approach to rigorous data collection and quality management. The goal would be to prioritize consistent data collection at every conceivable point of care, from the initial patient registration process through to discharge and subsequent follow-up appointments. It requires clear, unambiguous, and standardized protocols for documentation, so all relevant information is consistently captured across all departments and roles. Additionally, a significant change management component requires investing in quality training for clinical staff on proper documentation techniques and specific coding practices to improve data fidelity and reduce errors. The establishment of a single source of truth for all healthcare data is the goal, if not the ideal. While this may require financial and workforce investments that are not possible right now, taking a phased approach to system integration and upgrades as well as thoughtfully adopting industry-standard interoperability protocols can dramatically enhance data accuracy and accessibility. Leadership is key. Beyond technical solutions, the role of visionary and strategic leadership is crucial. Leaders need to build a data-driven culture, actively fostering an environment where data is valued and respected so it can be used to inform decision-making. This includes the transparent and timely sharing of benchmarking results, irrespective of whether they are positive or negative, to cultivate a culture of accountability and encourage organizational learning. Ultimately, investing in your data collection, analysis, and benchmarking capabilities is an investment in the future viability and success of your organization. It empowers leaders to make more informed and impactful decisions regarding resource allocation, ensuring that investments are directed to areas where they will yield the greatest possible impact on patient care and operational efficiency. It can also facilitate more accurate and reliable forecasting, enabling health systems to plan proactively. A call to action: building the future of healthcare through collaborative excellence. The path forward for healthcare organizations is clear. Embrace benchmarking as a collaborative journey towards excellence, not a competitive exercise. In my experience, working across different countries demonstrates a fundamental truth: healthcare challenges transcend borders, but so do solutions. When organizations commit to transparent data sharing and learning from best practices, the entire healthcare ecosystem benefits. The technical hurdles I've outlined, fragmented systems, inconsistent coding, and data silos, are surmountable. More challenging and requiring greater courage is the cultural transformation needed to view benchmarking as an opportunity for growth rather than a threat to reputation. Healthcare leaders must champion vulnerability in the service of improvement, recognizing that identifying areas for improvement is the first step towards delivering exceptional patient care. Consider the ripple effects of effective benchmarking implementation. When one hospital improves its surgical infection rates through data-driven insights, those learnings can benefit patients thousands of miles away. When a health system optimizes its emergency department flow, the methodology can be adapted across diverse healthcare settings globally. This is the power of collaborative learning, transforming individual organizational improvements into collective healthcare advancement. The investment required for robust benchmarking infrastructure may seem daunting, but the cost of inaction is far greater. Every preventable complication, inefficient process, and missed opportunity for improvement directly impacts the patients we serve. Embracing benchmarking empowers healthcare organizations to drive operational success and directly advance their fundamental mission: healing and caring for their communities. Successful healthcare benchmarking requires a mindset that champions trust, common standards, and patient outcomes over institutional pride. This requires a commitment to prioritize data sharing across organizations. Benchmarking is ultimately about honoring the sacred trust patients place in healthcare providers. Every data point represents a human story, every metric a life touched by our care. When we commit to rigorous benchmarking, we commit to continuous learning, relentless improvement, and the pursuit of excellence that our patients deserve. The question facing healthcare leaders is not whether they can afford to invest in comprehensive benchmarking capabilities, but whether they can afford not to. The future of healthcare depends on our collective willingness to measure, compare, learn, and improve together. The journey towards data-driven excellence begins with a single step: the decision to prioritize patient outcomes above all else.
Thank you, Julie, for sharing your expertise on the importance of benchmarking in healthcare. Your insights on how benchmarking helps us understand provider performance, patient outcomes, and drives continuous improvement are so valuable. We truly appreciate you highlighting how, despite these barriers, benchmarking can be a powerful tool to shape smarter strategies and improve patient care. More great conversations and expert perspectives are on the way. Stay tuned, and until next time, take care, everyone.